memory.
I want all of you to reach back in your memory bank and think about the best present your parents ever got you. Was it your first car for your Sweet 16, or a Power Rangers lunchbox for your first day of kindergarten, or maybe they're paying your college tuition? But what if I could tell you the best present you could ever give your children is one that you could give them the day that they're born? It would last the rest of their lives and could save their lives. I'm talking about banking your children's umbilical cord blood. Many of us have had family or friends diagnosed. Stem cells in cord blood are totipotent cells that can be differentiated later in life to save lives. According to the National Cancer Institute, 10,000 children are diagnosed with childhood leukemia and other cancers every year. That's a significant number, and what if that number was your child? As a pre-med major at FSU, I'm constantly trying out new research and looking into new opportunities to go for science and what I want to do with my career later. And that's one of them. I like thinking of new things and trying to figure out how to cure things. I know I'll be banking my future children's cord blood because it's one of the smartest decisions you can make. Banking your baby's cord blood for future medical uses is the future of science and medicine and could potentially save your children's lives. Today we will discuss banking cord blood, beginning with how stem cells are extracted non-invasively, talk about diseases that can be cured with these banked stem cells, and end with a visualization as to how the world will be if we have the availability of this cord blood for medical research. To begin with, I want to explain how stem cells are extracted from the cord blood. Normally, placenta and umbilical cord blood is thrown away at birth and never thought about again. However, stem cells, as I mentioned earlier, are totipotent, and that means they can be differentiated. If you ever need bone marrow transplant, another organ grown, they can go back to these stem cells and grow anything that they need, or tissue, an organ, anything. And your family members that could be potential bone marrow donors don't have to go through that harmful surgery, and it's just there. So if sadly your child is diagnosed with cancer later in life or is on a wait list for an organ donation, you may regret never banking that cord blood and having it as an option for a backup. Imagine watching your child deteriorate rapidly in front of you from a debilitating pediatric disease and knowing you didn't bank the valuable cord blood containing stem cells that could be used to save their life. According to CryoCell International, cord blood stem cells are easily extracted with no risk or pain to the mother or infant. Alternatively, bone marrow collection is an invasive procedure requiring general anesthesia and several risk factors. Banking now can save you or another family member from going through bone marrow transplant ordeals. While I hope it is sinking in how significant banking cord blood at birth is, let us further discuss the disease that stem cells from cord blood can help treat. To solve the problem of childhood cancer and diseases, we need to understand that banking cord blood would help alleviate some diseases, keeping kids off organ and bone marrow wait lists. These diseases include acute lymphoblastic lymphoma, leukemia, Hodgkin's, and many others. Imagine your child has just been diagnosed with a pediatric disease. They desperately need bone marrow transplants and have to be placed on a waiting list. They can't find a donor, and you have to watch your child suffer slowly. However, according to Viacord, acute lymphoblastic leukemia, acute myeloid leukemia, Burkitt's lymphoma, and others can be cured with stem cells banked from your baby's cord blood. Emerging treatments also include diabetes, cerebral palsy, brain injuries, and we are getting closer to being able to grow new organs with these stem cells. According to Cord Blood Registry at cordblood.com, many healthcare providers and insurance companies will now cover the cost to bank your children's cord blood. Now it's affordable to those who couldn't afford it. It was $3,000 a few years ago. It's starting to go down, but like I said, insurance is trying to cover that so that you don't have to. The solution to children suffering from childhood diseases such as leukemia, diabetes, and other cancers is to simply bank your children's cord blood. As stated previously, banking may be the most important decision that could potentially save your children's lives. Stop and think about the commercials for a second. St. Jude's, the Children's Miracle Network, all those children that are in the hospital bed, and you feel so bad for them and you always wonder what you could do. But all you have to do is bank cord blood. It may not be able to help your child if they're never diagnosed, but another child in need, a family member, anyone can benefit from those stem cells as long as the blood transplant works out. The unfortunate scenario can be reversed. Children don't have to suffer anymore from these diseases because of ongoing research and dedication to medical science. I know that I will bank my children's cord blood to prevent any chance that they would suffer without the possibility of a cure. To sum up what I have discussed today, banking is a positive, non-invasive security to ensure that your children will not suffer a pediatric disease. Everyone needs to educate themselves on this fact. Banking will continue research to cure pediatric diseases and cancer. So what am I asking you to do? I want you to educate yourselves on the potential life-altering benefits that your child could potentially benefit from banking their cord blood. After the severe illnesses that I suffered as a child and the endless possibilities of science and research, I will definitely be banking my future children's cord blood. Remember, children cannot help themselves. It is the parent's job and responsibility to ensure their safety and health. Banking stem cells from cord blood at birth is at least a venture in the right direction to potentially save your children's life if they are ever diagnosed with a pediatric disorder.